When a brittle hair strand fails under tension at the root, the immediate reaction is to treat the scalp. But traditional Chinese medicine operates on a very different physiological premise, defined by a single foundational axiom: hair is the surplus of blood. In this medical framework, the hair is never treated as an isolated epidermal feature. It is an extension of a much deeper internal ecosystem. Thinning, premature graying, and excessive shedding are terminal manifestations. By the time a follicle physically weakens, a long chain of internal dysfunction has already occurred. That dysfunction typically originates in one of three primary organ systems responsible for systemic balance: the spleen, the liver, and the kidney. We are going to map exactly how modern hair disorders correlate to specific breakdowns in these three organ pathways and decode the non-invasive clinical signs used to diagnose them. Preventing hair loss requires fixing the internal manufacturing and delivery systems of the body, rather than endlessly treating the surface of the scalp. This network diagram illustrates the internal supply chain, starting with the spleen node. It extracts nutrients, transforming them into qi and blood. If it underperforms, the raw materials to build a hair follicle do not exist. Once produced, blood moves to the liver, which acts as a storage reservoir before routing this supply upward. The liver maintains smooth circulation to ensure this nutrient-dense fluid reaches the scalp. At the base lies the kidney. It stores Jing, the bedrock vitality governing human growth. It sends a deep flow of Jing upward to physically reinforce the hair root. While spleen and liver blood provide the daily fuel required for hair growth, kidney Jing provides the long-term structural blueprint. For a hair to remain tightly anchored to the scalp, thick in diameter, and richly pigmented, all three of these pathways must operate simultaneously. Hair thrives when the spleen manufactures, the liver delivers, and the kidney sustains. Watch what happens when the spleen and kidney dim. Production drops, the upward flow dries up, and the scalp hub withers. This systemic blood deficiency presents clinically as diffuse, scattered hair thinning, common in postpartum hair loss. This diagnostic graphic shows the external markers: a noticeably pale tongue indicating low red blood cell saturation, and a text readout analyzing a thin pulse, feeling faint under the practitioner's fingers. A pale complexion and a thin pulse prove that the physical reservoir of blood is exhausted. The body prioritizes vital organs, starving the scalp. A deeper depletion occurs when kidney Jing fails. This essence naturally declines through the aging process, chronic illness, or specific genetic predispositions. When Jing depletes, the structural integrity of the follicle degrades. In modern clinical terms, this maps directly to androgenic alopecia, genetic hair loss, and premature graying. The high Jing environment of youth produces rapid, vibrant hair growth. As Jing wanes, the output becomes structurally weak, brittle, and eventually ceases entirely. Applying topical chemical stimulants to the scalp will yield no permanent result if the internal reservoirs of blood and essence are completely empty. When the delivery system is paralyzed, a different pathology emerges. Severe emotional stress acts as a physical clamp on the liver node. This liver-qi stagnation strangles circulatory pathways, severely restricting flow and starving the scalp. This maps precisely to stress-induced sudden shedding, known as telogen effluvium, or the sudden appearance of localized bald patches seen in alopecia areata. The diagnostic signature for this stagnation is a wiry pulse. It feels taut under the fingers, vibrating exactly like a heavily tensioned guitar string. Red and orange elements represent damp heat. Generated by internal inflammation, this material rises, creating sticky blockages at the follicle base. Clinically, this drives seborrheic dermatitis and fungal disorders, creating oily, itchy scalp conditions. The diagnostic markers are aggressive: a red tongue covered in a thick, greasy yellow coating, accompanied by a rapid, slippery pulse. Emotional tension and systemic inflammation act as physical barricades, locking nutrients out of the hair root regardless of how healthy your diet might be. The core logic of intervention is highly specific. Acupuncture bypasses the surface of the scalp to correct the exact systemic node that has failed. On this map, we nourish blood by stimulating stomach 36 and spleen 6 to boost manufacturing. Kidney Jing is tonified by targeting kidney 3 and bladder 23. To move liver qi and break stress stagnation, practitioners combine liver 3 with large intestine 4. Patients are frequently instructed to utilize points like stomach 36, spleen 6, and liver 3 for daily home acupressure, maintaining systemic regulation between clinical visits. Dietary interventions directly feed these nodes. Black sesame and walnuts anchor Jing, while broths and dates rebuild blood. Simultaneously, patients presenting with damp heat must observe strict dietary restrictions, eliminating fried foods, excess sugar, and alcohol to starve the inflammatory response. Specific needle placements and clinical diets function as targeted code, reprogramming the internal organs back to their functional baseline. Because hair generation relies on slow, steady physiological cycles, systemic treatments require a timeline of months, not days. This timeline chart maps the reality of clinical recovery. Improved digestion and deep sleep usually peak here at week 4, while new follicular density only begins a measurable rise around month 3. Because liver qi stagnation causes hair shedding, dedicated physical stress reduction, like the fluid, meditative movements seen here, is a mandatory clinical requirement to restore circulation. The highest clinical success rates occur when treatment is initiated at the first sign of excessive shedding, before the follicle matrix permanently degrades. Superficial treatments prioritize the aesthetic surface, but the traditional Chinese medicine framework demands actual internal equilibrium before it can build a robust follicle. Thick, resilient hair is not a cosmetic accident.